So I'll be discussing adenovirus. So introduction, adenovirus causes respiratory, GI, and urinary tract, and in the eye disease. So multisystemic, okay? So when you see a patient and they have respiratory symptoms, GIT symptoms, urinary symptoms, and eye symptoms, think of adenovirus. Many adenovirus infections are subclinical, and the virus may persist in the host for months. Subclinical means you have the virus in your body, but it does not show the signs, okay? About 1/3 of the 57 known human serotypes are responsible for human adenovirus. If you do that math, that is about 19 of them, 1920. A few types serve as models for cancer induction in animals. They are also useful vectors for gene therapy approaches. So adenovirus, they're used in gene therapy approaches. That's how we even developed the vaccine, the COVID-19 vaccine. We used adenovirus. So this is the adenovirus vaccine, as you can see. They are DNA vaccines, first isolated from adenoid tissue in 1953. The family consists of double-stranded DNA viruses, okay? They have been recovered from many mammalian and avian species. Many are found in the respiratory tract, and infections are often persistent. Only a small number cause significant veterinary disease. So mostly they occur in human beings. Can you see this? So I said they're double-stranded and linear. I don't know if I can zoom, but as you can see, it's very unique because there are these projections that come out of the structure. We call them fibers, okay? Then this is the DNA particle, which is linear in shape, as you can see. And then this is the core protein that makes up the virus, okay? Does it have a capsid? No. It has no envelope that is covering it, okay? Adenovirus exists in all parts of the world. They are present year-round and usually do not cause community outbreaks or disease. Most common serotype in clinical samples are low-numbered respiratory infections. So we have adenovirus 1, 2, 3, 5, and 7. And then the ones that cause gastroenteritis are 40 and 41. So these are common questions they're going to ask you. Which of the following adenovirus serotypes is responsible for nausea and vomiting in children? Okay, they will ask you that. So the serotype is 40 and 41. Most adenovirus-related diseases are subclinical, as I had mentioned. Infections in serotype 1, 2, 5, and 6 occur chiefly during the first years of life. 3 and 7 contracted during school years. And then 4, 8, and 19 may not be encountered until adulthood. So you'll see this virus, as we're going to see, it's common in children during the first year of life and during school years. And then for adults, it does not just catch the normal adults. So it is, you'll find adults, so mainly who live in subquarters. What subquarters are, for example, in military barracks. So you find an adult who lives in military barracks, and then if one person gets, it can easily spread within that barrack, but not outside of the community, okay? This family includes 2 genera designated based on genetic criteria. We have Adenovirus and Adenovirus, as well as 3 genera in which adenovirus are combined according to the type of host. So we have Aviadenovirus, Ichadenovirus, and Mastadenovirus. So genus Mastadenovirus includes various viruses of mammals. So the cow, sheep, deer, pigs, dogs, along with all human viruses. So this is the relevant one. In humans, 57 adenoviruses are known, which are divided into 7 groups. Okay, so this is just a bit of classification, though not asked. This is just good to know. This is now the must know, you should know. The source of infection, a sick person in the acute stage of the disease, convalescent, or a virus carrier. Okay, so let's say you're having the disease, We said it presents with gastroenteritis. So if it's gastroenteritis, that will be fecal-oral. Okay. So what is fecal-oral? Meaning you can get it through, let's say, improper disposal, human disposal of feces. Okay. We can have flies. You know, flies can also spread this. If your feces are properly disposed, when a fly goes there, then it lands on your food, it's going to spread the virus. You can have hygiene issues, so you don't wash your hands properly. Okay. And then what other way we have? Yeah, those are the ways we can get it. Okay, so for example, if I'm a sick person and then the flies goes, or you have dirty fingers, you get the disease. Or you're a virus carrier, you can also spread the disease. Convalescent, this is someone who's recovering from a disease. So for example, I've been treated and I'm recovering, I can also spread the disease. Pathogens are secreted with nasopharyngeal secretions. So this includes mucus, saliva, sputum, conjunctival discharge, feces, and urine, mainly in individuals with immunosuppression. So immunosuppression, these are like the HIV patients. Adenoviral infections are transmitted by airborne. So these secretions, introducing the virus to the conjunctiva and possibly fecal-oral route, thus affecting not only the respiratory system, but other organs. Widespread disease is 5 to 10% of all viral diseases. Incidence is recorded throughout the year with a rise in the cold season. Both sporadic cases, so sporadic, we said the ones that come out of the blue, and then epidemic outbreaks can be observed. The most susceptible to infection are children from 6 months to 5 years, as well as military personnel, since they live in close barracks that have in very close contact. Okay. So have we understood the transmission? If you remember, it causes GI symptoms, so fecal-oral. If you remember, it causes respiratory symptoms, so airborne. You remember it causes eye symptoms, so introducing the virus to the conjunctiva. So how can one get this? For example, transplants, corneal transplants, or sharing of eye drops. So if you don't put your eye drop properly, you know, there are some people when they put the eye drop, the tip of the eye drop can touch the conjunctiva. So when that happens, you can spread it, okay? Then the diseases. Adenovirus primarily infects children and accounts less in adults, except those who live in the military barracks. Most adenovirus infections are mild and self-limiting, okay? So when you get it, your immune system is going to fight it, then you're going to be okay. But once you get it, these are the symptoms you're going to present with. We start with the RESP, pharyngitis. So remember, I told you, when you hear the word itis, it means inflammation. So pharyngitis means inflammation of the pharynx. So adenovirus is a major cause of non-bacterial pharyngitis. There are other causes of pharyngitis, which are bacterial. So adenovirus, you know, it's a virus, so it's the major cause. Pneumonia. Pneumonia, we know pneumonia. Everyone has heard of pneumonia, where we have inflammation at the terminal bronchioles. Okay, adenovirus 3 and 7 associated with pneumonia. Acute respiratory disease. So it will mimic a cold or a flu. So we can have fever, rhinorrhea. Rhinorrhea means the flow of mucus, okay? And then we have cough, a sore throat that lasts for 3 to 5 days. So as you can see, it's very self-limiting. And then we have pharyngoconjunctival fever. So pharyngoconjunctival, from the word pharyngo, so it starts from the pharynx, conjunctival goes to the eye. So fever, then conjunctiva will have red eyes. Okay. Have you seen people with red eyes? They usually have conjunctivitis. Okay. Sore throat that occurs primarily in school-going children. This is quite common. I'm sure you guys can't remember, but when you were young, you'd see many people have sore throats and red eyes. So they usually got adenovirus. It's quite common. I usually interact with school-going children, and I usually see they have, majority of them will have this, but it's usually self-limiting. Then eye infection, keratoconjunctiva, keratoconjunctivitis. Sorry, can you hear my background noise? It's raining here. Can you hear it?
I can't hear it personally.
Oh, if you can't hear it, it's okay. It's raining here. Keratoconjunctivitis, highly contagious and characterized by photophobia. So photophobia is the fear of light. Phobia means fear. Photo means light. So the fear of light. When you're exposed to light, you get pain, or you just fear it. You don't want light exposure. Tearing, there'll be increased tearing on the eye that is infected. Pain and inflammation of the conjunctiva. We call it conjunctival injection or the red eye. Okay. Gastrointestinal infection. So basically it causes gastroenteritis, intangible gastroenteritis, characterized by fever and watery diarrhea. You have to note, you'll see some MCQs. The following are clinical features of adenovirus. Then they put their bloody diarrhea. So bloody diarrhea is not there, okay? It causes watery diarrhea. Take note of that. So this is the most common infection you'll see. The children will come, they have a fever and they're diarrheaing. Most likely it's adenovirus. Then here are the serotypes and their clinical manifestations. So respiratory diseases, we have serotype 1, 7, 14, 21. Pneumonia, 1, 3, 4, 7, 55. Conjunctivitis, 3, 7, 8, 10, 14, 19, 37. Gastroenteritis, 9, 11, 31, 40, and 41. Meningoencephalitis, 2, 6, 7, 12, 32. This one is rarely asked, but the one that I've seen is gastroenteritis. They'll ask the serotype for gastroenteritis. The answer is usually 40, 41. Okay. But as you can observe from the pattern, the resp infections are the low numbered, 1, 7, 1, 3, 4. And then gastroenteritis, the high numbers, 31, 40, 41. Diagnosis. So it depends on the nature of the infection. So it depends on what the patient has come with. If they've come with respiratory symptoms, we do a throat swab. We do an esophageal aspirate. So this is the sputum one. If they've come with eye infection, red eye, tearing, and pain, conjunctival aspirate, conjunctival swab. Then urinary symptoms, you take urine. Remember we said urine it's not found in normal patients. You have to be immunocompromised. And then we have, stool. So the watery diarrhea, then blood, and then bodily fluids. So there's one, sorry, I did not indicate it. There's one disease adenovirus causes that I have not indicated it. It's called acute hemorrhagic cystitis. So it's acute hemorrhagic, meaning that blood is involved, and then cystitis. Cystitis means, I said when you hear the word itis, it means inflammation. So cystitis, so cysta, so that is involving the bladder, okay? So acute hemorrhagic cystitis, inflammation of the bladder leading to bloody urine. So we have something we call hematuria. Hematuria is blood in urine. And then they usually have painful urination. We call it dysuria. But what is usually common in acute hemorrhagic cystitis is they don't have fever, okay? They usually no fever, and it's usually self-limiting. So you'll find a small child, 5 years old, comes with blood in urine, and sorry, I've said there's no fever. Blood in urine and painful urination. So you'll think of acute hemorrhagic cystitis, which is caused by adenovirus. And then for the tests, we have already taken the specimen. We start with microscopy. We have electron microscope. to see the viruses. Then antigen detection, we have ELISA and fluorescent antigen test, DFA. So we're detecting the viral DNA. Serology and antibody detection. So we want to check presence of antibodies against this adenovirus. Molecular technique, we have PCR, DNA probe, these ones we have done. Then viral culture, the cell line culture. Then prevention. Remember, when you're asked about prevention, the first answer is usually health education, regardless of the disease, regardless of the virus, regardless of the bacteria, regardless of the fungus, regardless of the parasite, all these microbiological agents, the first thing is usually health education. So you have to educate the masses and tell them about the certain virus or bacteria or fungus or parasite, okay? Then the next one is you have to now treat, not really treat, but prevent and control the ways the virus is spread. So for these ones, we have said fecal-oral. So careful hand washing is the easiest way to prevent infections, okay? Proper disposal of feces, okay? Cleaning, practice proper hygiene, okay? Because one way it can be spread is contact with contaminated surface. I go to the toilet, I don't wash my hands, I touch the table, I go eat. Someone will go touch the same table and go eat. So you're spreading the virus. So we have to practice proper hygiene. That's why we're saying environmental surfaces can be disinfected with sodium hypochlorite. In group settings, paper towels may be advisable because dirty towels can be a source of infection in outbreaks, okay? Waterborne outbreaks in conjunctivitis can be minimized by chlorination of swimming pools and wastewater. So you can imagine you go swim in water, you know, some people don't wear goggles, you have conjunctivitis. The virus is spread through the water. And if the water is not chlorinated properly, people will be infected. Then strict asepsis during eye examination, coupled with adequate sterilization of equipment. As I had said, you're doing a corneal transplant, you have not sterilized your equipment properly, you can spread the virus. Then military have focused on vaccinations. So because as we have said, it's easily spread in adults in these barrack settings. So focus on vaccination. Live adenovirus vaccines contains type 4 and 7 encased in gelatin-coated capsules and given orally. It was introduced in 1971. In this way, the virus bypasses the RESP system where it could cause disease and it is released in the intestine. Okay. So for prevention and control, easiest way to remember is how is the virus spread? Then you try and prevent and control on those ways. Okay. Any question on adenovirus? I think I'm done. It was a short lecture.